We have a product here that was sent to me for not so much a review as a demonstration. And this is a hemostatic gauze. So this is gauze that is treated with a mineral, zeolite, that will cause blood to clot. And this is used in a very specific situation. This is something that if you're putting together an IFAK or individual first aid kit, you should definitely have. Anywhere where you could need to stop bleeding fast, there's a few things that you should have. Now I'm gonna go over one other product. I wanna also emphasize this video does not take the place of first aid and trauma training. I used to teach defensive firearms and we always did a segment on first aid. It is something that you are much more likely to use. This product here, you're much more likely to use in your day-to-day running into somebody who has uncontrolled bleeding, and bleeding is one of the first things we want to stop in a trauma. So the first thing I'm going to go over, tourniquet. So this is going to be anywhere from here down, anywhere where I can get that tourniquet above. But I run into a problem when I'm here. If I have a puncture wound here in the shoulder that I can't get this around to stop the bleeding, I need something to stop it. Now this talks about on the packaging superficial wounds. I'm going to teach you a different thing that you should be doing in the case of trauma. This is not something for a small scrape or cut. But so you open this up, and you can do this with regular gauze, but it's not as effective. And I have this dummy here that has volunteered, and he sacrificed his arm for the sake of this experiment because I'm not going to sacrifice mine. All right, so when I go to pack this in, I'm just going to be shoving it into this wound that I have here. So I'm going to be just shoving this in there, and I'm basically just going to shove in as much as I can until that wound is completely full and packed. If I get this wound packed and I run out of material, I can use rolled gauze, but it won't have that clotting agent to keep this from, or to stop the bleeding faster. So I'm just going to keep packing this in, and I'm going to pack in as much as I can. This is not going to be pleasant for my patient here, but I need to get this to stop bleeding. So we're going to pack this in, and this is a lot that this is taking here. We're just packing gauze in there. We're about full there. Again, this is field trauma. This is to get him to a hospital, him or her. So I've got it packed in, and now what I'm going to do is I'm going to take whatever's left over and I'm going to wrap it around nice and tight. I'll tuck that in under. Again, this is at the shoulder. This is somewhere where I couldn't get a tourniquet. I can't get up above it, so I had to pack that wound. So I definitely suggest getting further training on field trauma, what you should keep inside of an individual first aid kit, things that you should keep in a vehicle, anything that you need that you could get somebody to a hospital and to that better care. That's the goal with this field trauma and first aid. It's first aid. It's not the hospital. You're not going to be performing surgery on the side of a trail. Your goal is to stop bleeding, open airways, and keep the heart pumping. So definitely get some better training. If you've never had any kind of trauma training, if this was a new experience that you didn't know that this is how this worked, sign up for a class. I can't recommend training enough, but definitely keep something like this in that individual first aid kit.